Let's learn about a tissue expander. When you learn the different parts of a tissue expander, it'll help explain some of the sensations that you're feeling after surgery. This is what a deflated tissue expander looks like. You can see that there's a port, there's some blue tabs, and it's completely deflated. These blue tabs are what I use to suture the tissue expander exactly where I want it to make your breast eventually. I do suture these to the chest wall, and that's why sometimes people can feel muscle spasms after surgery because it's literally sewed to your chest. The second thing that you might feel after surgery is the port. So this port is what I can find with a little magnet finder after surgery, and then I can put a needle into this self-sealing area of the tissue expander to put fluid in or out without popping the rest of the tissue expander. The third thing you might feel after a tissue expander is placed are edges. You can see that if it's deflated, it's kind of all folded up on itself like a weird pull toy. Sometimes you can feel these edges through your skin, especially if you're thin, after surgery. This can be very concerning to patients. They wonder why they're feeling lumps and bumps. It's all very normal. The way I explain it to my patients is think of it as like a really weird deflated pull toy. It doesn't look like the magical unicorn inflatable it's supposed to look like, but when you inflate it, either with air or saline, it's going to build the shape of a breast. The other important thing to point out is a tissue expander is somewhat shaped. You can see there's more space on the bottom to fill out the bottom of the breast versus an implant. An implant is a perfect circle, as wide as it is tall, it's not shaped. So a tissue expander will look different on your body versus an implant. I hope those explanations clear up some of your questions about tissue expanders.